My name's Eileen and I was diagnosed with AF 9 or 10 years ago. AF has affected my lifestyle quite a lot. It's one of those things that it affects you as much as you let it. But initially, I didn't do anything. I wouldn't drive the car. I wouldn't go out shopping on my own. I won't say I stayed indoors, but I certainly didn't go very far. One of the problems is that you look well. So if you have to leave an evening early because you're not feeling well, one of the comments is, but you look fine, which isn't always very helpful because it makes you feel guilty. It made the family very unsettled. My husband was quite convinced that I was going to drop down dead, I think. My daughter was just worried. She didn't like going to school. She didn't like going off and leaving me. It's like living with a time bomb. You're just waiting for something to happen. When I first had the AF, I was not made aware of the risk of stroke. But when I was referred to the cardiologist, it was explained in great detail how much at risk I was by using diagrams and models of the heart. I wasn't aware that AF-related strokes were more dangerous than other strokes initially, but then having seen my mother who had an AF-related stroke and how seriously affected she was, I suppose it was a realisation that came gradually rather than just being informed. It gradually soaked in that it could be quite nasty. My mum's AF-related stroke was quite difficult. At the time I was in hospital and expecting my daughter, so I had days out to come and visit her. It was a serious stroke. It affected her speech and her right side. I lost my mum when she had her stroke. I suddenly became the head of the household as the only child. The mother that I knew wasn't there. She had no speech. She couldn't write to communicate either. We communicated by drawing boxes, but she wasn't very good at that because the stroke had affected her right side. So she had to learn to draw with her left hand. It was a bereavement when she had her stroke, as mum had gone, the body was still there, but the person inside it wasn't. It was dreadful. There definitely needs to be more awareness of AF and AF-related strokes, because for many people, the first time they know they have atrial fibrillation is when they're admitted to A&E with stroke, and education would possibly prevent that.